Hello and a welcome to you. A warm welcome indeed. Roy Noble here, and it's a great privilege and pleasure to be a Bevan Commissioner as we gather together for this auspicious occasion. Croeso cynnes i chi gyd, fel ni nawr wedi dod at ein gilydd fel casgliad arbennig am y diwrnod yma sy'n mynd i, wel, godi i'r ysbryd, fi'n gobeithio. Something that will be uplifting. The showcase for the Adopt and Spread program, supporting adoption sites as they take Bevan exemplar innovation across Wales. Do you know, I've always been rather jealous of those who are innovators and creators in that kind of way. Does it come in a flash or does it gradually build in the mind? Somebody once told me that the world is divided into two kinds of people, those who do and those who get the credit for it. Actually, I believe that the world is divided into three kinds of people, those who make things happen, those who watch things happen, and those who merely ask, what's happening then? The bystanders. You really need the movers and the shakers and the doers and the makers. And the dreamers, of course. But the dreamers need the doers to put the rivets in the dreams so that those dreams will come to fruition and take you to that extra mile. You will find that the extra mile is never crowded, really. They do say that Humphrey Davy and Edison in stages produced the electric light bulb. But I bet you the extra mile saw that the man who invented the meter made all the money, don't you think? Now then, the Bevan Commission has been leading the National Adopt and Spread program across Wales over the last 18 months, building on the work over the last 5 years with the Bevan exemplar innovators indeed. And 15 of the Bevan exemplar innovators were selected to share their innovative work with a new site. Over 50 new adoption sites have taken on one of these great innovations, let me tell you. And over 150 people have been involved in the adoption and spread of innovations right across Wales. Now, the work, you must remember, has taken place during COVID-19, and the participants have had to work exceptionally hard over and above the work they normally do, because all this is an extra for most of them. And they've had an impact on us all, and to ensure that we learn from the program and the ideas that they've actually come up with. Now then, there is a panel of project members with us today, and they participated in the Adopt and Spread program, and they have guests with them as well, so everyone is very, very welcome. And they will be ready to answer questions. And if you could put your questions in the chat box, the host will make sure that your question is asked, and hopefully that it is answered as well. So you're welcome again. So be prepared to be interested, to be enthralled, and to be inspired by what is on offer today. Diolch yn fawr i chi. Mwynhewch. Enjoy.
Hello and welcome to the Bevan Commission Adopt and Spread Innovation Showcase. Back in 2015, we set off with the Bevan Exemplar programme, and we found that across the NHS in Wales, there were many examples of fantastic innovation that we could develop and we could spread and share them across the NHS. But there was nothing in place to support people to do these things. There was nothing in place to support people to spread their innovation, and there was nothing in place, critically in this instance, to support people to adopt the innovation. Because whilst innovation is great and fun to do, the process of adopting the innovation is also great and fun, but it's quite hard work. So we set about with the Adopt and Spread Innovation Programme to help the adopters to adopt the innovation, to adapt it and to improve it to context. When we set out, we had 150 exemplar projects, and we asked them who was interested in joining the programme. About 50 of them said yes, and we supported those to try and find adoption sites. Through a process of elimination and people demonstrating interest in an application, we whittled that down to 15 projects that started off the blocks almost 18 months ago from today. Over that period of time, a couple of them have dropped off because of COVID, but 13 projects will join us over the next couple of days with 40 or more adoption sites to share their experiences of taking part in the programme, but most importantly, their experiences of delivering and supporting innovation adoption across the NHS in Wales. I think it's been a fantastic journey. I've really enjoyed it in the part that I've played. I think that the people you will hear from are absolutely inspirational and formidable agents for change and innovation across the NHS in Wales. And I'm sure that you will enjoy listening to their stories, and hopefully you will ask them questions to learn from their experiences. So I will hand you over to your host, who will take you through the rest of the day. Have a really great...
Good afternoon and welcome to the session on stance. My name is Mair Hopkin. I'm Joint Chair of the Royal College of General Practitioners in Wales, and for over 30 years I was a frontline GP in Pontyclun. I know how difficult diabetic foot disease can be for patients, for their GPs, and for the members of the teams that look after diabetic patients. We were very lucky at my practice. We had a local diabetic foot clinic, but that meant patients going to the hospital and possibly missing time off work. Post-COVID, we know that there are huge delays and backlogs, either waiting lists or patients who haven't come forward with illnesses, and prevention has never been more important than it is today. There are over 200,000 people in Wales who live with diabetes. That's 8% of our adult population, and it's the highest prevalence in the UK. Feet are important for our well-being. If we have reduced mobility, then that leads to isolation. Isolation leads to loneliness, and loneliness leads to low mood and poor quality of life. So without further ado, I'd like to introduce the panel today, and I'll ask them to give their own introductions. So we'll start with Sujata.
Hi, I'm Sujata Taladi from The Mentoring, a charity based in Cardiff. We are a mentoring charity that provides mentoring in the areas of education, employment, health, and community cohesion on a case-to-case basis for any individuals from any background. We are based in Cardiff.
Thank you. Sarah.
Hi, I'm Sarah Tomlinson. I'm a self-management programme manager based in Howell Health Board. We deliver multiple education programmes for people living with long-term health conditions.
Thank you. And we seem to have lost our other panellist. We should also have with us Michelle Rigby from Betsy Cadwallader Health Board. So hopefully, if we now play the video about the project, hopefully we can find Michelle and she'll be here to answer some questions afterwards. Thank you.
Fliss knows all about living with diabetes, and she wants to tell everyone about it. And she does, when she attends her Stance Diabetes Foot Care Information Group. She has learned lots too. By listening to the experiences of the Stance Group, she now knows how important it is to go to her annual foot assessment and to recognise if she has any complications with her feet, such as numbness or poor blood supply. She also now understands the need to know what her blood glucose results are. That's her HbA1c number, because this can affect her feet quite seriously, causing foot wounds, infection, and in some people, amputation. Since going to Stance, Fliss knows she can help prevent this from happening by taking care of her feet and making sure her HbA1c is at her target level. She notices that her toes are hot and she has a wound. Fliss remembers about Act Now from her Stance session. She knows she must get help quickly from a health professional. Fliss's friend Bhavna isn't so sure about going to Stance though. She would rather learn in Hindi and with people from her community. Go on, Fliss, do what you do best. Get talking and tell her all about it and how she can choose a group that suits her. Be involved with your foot health. Take part in the Stance information session. As part of the National Adopt and Spread programme, we have recruited and supported successful adoption in Hywel University Health Board, Betsy Cadwallader University Health Board, and for community groups within Cardiff and Vale University Health Board. This work included adaptations for multilingual sessions and reaching diverse ethnic community members, as well as tailoring for different service contexts. Supporting foot health engagement and empowerment education in the community is a service priority for people with diabetes. This Bevan exemplar is ready for adoption in specialist services and community settings.
Thank you. So, Sujatha, would you like to tell us a little bit about the history of stance, how it spread across Wales and outside Wales?
Of course. Thank you, Maya. Developed in collaboration with the Bevan's Commission in 2016, Stance was created to provide standardized key information for people living with diabetes referred to the Cardiff and Vale Podiatry Department. The aim was to provide an interactive group information session for patients about how diabetes affects their feet over the long term and what the complications are and how they look like and how to self-care and why is this important, especially managing their blood glucose, and finally how and when to get help when the patients need it, not when the podiatry department think they needed it. Adjustments in the podiatry service were to provide group education followed by a one-to-one consultation for each patient with the aim of increasing knowledge and confidence to self-care and get help when needed, and also reduce routine monitoring appointments every 6 to 12 weeks for those activated to self-care. Also redeploy resources to providing open and rapid access and support for those patients who identified a foot health problem or needed additional help to self-care. In 2018, over a 6-month period, the change was applied to only to new referrals into the services, not the existing patients. A projected cost avoidance of for the patient seen in that period was nearly £100,000 per year. With the engagement of education program for patients and the mentoring charity under the involvement of the National Diabetes Framework for Wales 2016 to 2020, the possibility of spread and scale was realized.
Thank you. So Sarah, your team was part of the original collaboration between Stance and EPP and were the first to deliver Stance outside of a podiatry team. What benefits did EPP bring to the delivery of Stance?
So we trained health educators, so that gives us a skill set which enables us to engage participants in the learning, and we was able to work out how best to fit Stance into our education programs that we currently run. So we're also working in partnership with our podiatry team in Hywel. So we had a good foot in the door, let's say, so to get us through with the podiatry services. So that's kind of where we went from there. That the skill set that we've got to get the patients involved.
Okay. I was going to ask Michelle a bit about why her health board decided to adopt Stance. So would one of you like to tell me a little bit about how the health boards got engaged with Stance?
With Michelle's side, from what I remember, she's really tested me now, is they'd gone through the Adopt program because they were interested because we run diabetes programs as well. So they were looking at the Stance through linking into the diabetes side for them. So they got involved with that and applied and got through. The same for us. We obviously were developing it initially with Angela in Cardiff. So we was already working alongside them to deliver a way of doing it, an education session. So that was more user friendly and able to be able to put out quite easily for other services to be able to deliver it. So.
Okay. So could you tell me anything about any barriers that you faced in trying to get this disseminated, to try and get this adopted, or any positive encounters that really helped you along the way?
I can't answer for Michelle because I'm not sure what she's actually had there. We ourselves really didn't have any barriers towards it until COVID came. So our podiatry team were happy to work alongside with us. COVID came and we'd done initially a first session. We'd done the first session. I was the first one to deliver it initially, and I did it alongside a group of diabetes patients that had sat a 6-week education program. And that worked fine. But when we did the standalone, the barrier that we came up against there, some of the issues, was that some of the patients had not done the diabetes education program. So we found that they were going away with more questions than they had answers because they needed a lot more information about diabetes and how that's affecting the feet than what they actually got within the stance side of it. So that caused us a bit of a barrier to just running them straight away, although it did have a positive effect in the fact that we could move people onto our diabetes programs. So it was a bit of both. It was a bit of a barrier, but also it was a positive. So what we did and learned from that is that we now have the stance program that sits at the end of our diabetes programs over the 6 weeks, so that those have got the beginning of the education about the diabetes, how to manage that side of it first, and then how to look after the feet and what to look for and how to manage that bit as well. So it started off as a little bit of a barrier, but then became actually a positive. With regards to with the podiatry team, we didn't have any barriers. We already got a good working relationship with our podiatry team, and they are happy to come and help and get patients to come through and refer people as well.
Okay, thank you. So Sujatha, your project is slightly different to the other two because you're a charity sitting outside the NHS in the third sector. Tell us a little bit about how and why you got involved in adopting the Stance project.
It's very interesting. The mentoring organizes minority ethnic communities health fair annually to help individuals from different ethnic backgrounds become more aware of their own health needs and to enable health providers to improve their understanding of community health issues. At the fair, I met Angela Jones from the Cardiff and Vale University Health Board Podiatry, and together we came up with the idea of delivering the foot care education to minority ethnic communities members with diabetes in ethnic languages. That's how we came into the picture, and we applied for funding with Bevan Commission, and here we are.
Well done. So could I ask you both how you adapted the Stance project to fit the needs of your participant cohort?
Yeah, so for us again, it was when we realised that running it as a standalone session, that people were going away with more questions than answers, that we adapted it to move to the end of a 6-week session. We've also, with COVID coming in, we then adapted it to be able to deliver the session online through Microsoft Teams. So we've just changed a few little bits, but it means that we've actually reached a group of people that we might not have reached before. So especially any housebound people that were there, so they've been able to log on and do a session kind of like this, but through Teams, and it's still interactive. So we've adapted it because of COVID to be an online interactive session.
Sujatha, was there anything you wanted to say?
Yeah, for our beneficiaries or patients, medical terminology and jargon may constitute a barrier to understand health information in general, and particularly foot care education, we thought. So we translated the training material in a way that was very colloquial and in 4 different languages, that is mainly Arabic, Bengali, Hindi, and Urdu. And we recruited volunteers who speak the language and who could get connected with the patients who got diabetes. So EPP had kindly delivered or provided the training to our volunteer mentors, and we advertised the sessions in spite of the pandemic and the lockdown. We expected individuals to come from Cardiff, but people from Cardiff and Newport and also Swansea had attended the sessions and have really benefited with these sessions.
So I was going to ask you how COVID has affected sort of adopting and adapting the plans. Sujatha, did you manage to keep up face-to-face meetings despite COVID, or did you have to make adjustments?
No, we had to, because initially we had issues with IT and Zoom links, because patients or those who are carers did not have IT skills, and especially Zoom. It's a very delicate situation wherein they have to come out with their health issues publicly or openly in front of other people who they did not know at all. So we had to clear that barrier first. So it took a bit for us to make sure that they're all comfortable sharing their concerns about their food problems and having diabetes. So initially it was difficult, but then they become peer mentors, friends, and they came out with a lot of ideas as well. So we broke down that barrier of not feeling shy or concerned about who's listening, and just feel at home and everybody is the same and we have to go through the same process. So that was good. And online session had encouraged them to talk, which is very good. And we taught IT skills to some of the patients who were alone, but those who are carers, we provided training for carers, how to use Zoom links and how to talk, how to mute. We all do that mistake anyway. So we have adapted. But now with the lockdown being lifted, we are giving a one-to-one sessions as well. So we are continuing the project.
So there's probably been some benefits that you hadn't intended, with people being able to engage with Zoom and Teams and learn IT skills that they probably wouldn't have learned if it wasn't for the pandemic. I think we've all become a lot more IT literate. Okay. So Sarah, is there anything else you want to say about how COVID has affected this adopt and adapt?
No, I think pretty much like Suj said, that some of the IT barriers that we've had to overcome, and we had to learn it ourselves very quickly and work out how to use, because we use Microsoft Teams through the health board. So we had to learn very quickly on how the system works, and then be able to support participants getting onto it as well. So that was a barrier that we had to try and work out very, very quick.
Okay.
I have a message from Angela. Can I say that?
Yes, please.
That question. For Angela, time to spend with the team and loss of contact with majority of the patients for the podiatry department, to refer to the mentoring. Maybe it's the same for other health board. That's what Angela wanted to make sure. Loss of face-to-face interaction that created a meaningful and trusting relationship with patient had been lost. So that's what is the message from Angela Jones.
Okay. So how about funding? Was funding easy to get for these projects?
As far as we are concerned, it was difficult, but Bevan Commission was very kind enough and they have funded our program. But we are struggling now for the next year how to do it, and we'll be happy to have Bevan Commission support for the future, as well as for different projects too. So we are planning, hope to get it.
That often seems to be a problem, doesn't it? You get initial funding to set something up, and then it's the ongoing funding to keep it going and to actually spread it out that seems to be an issue.
Yes.
Yes.
All charities have the same problem. So
yeah. And I guess the charities have suffered a lot because of the effects of COVID. I know a lot of charities have lost sources of income because of COVID. Okay. And the technology, do you think that Zoom and Teams works okay for what you're delivering?
Yes, interestingly, some of the patients, some of the beneficiaries said, oh, we don't have to depend on our partners to drop us and we can just go online. So they're finding it very easy now. I think they're more comfortable coming online these days. And also, as I said, they all have become friends and they're bringing new people, those who got diabetes, and said, oh, come along and join us. So, which is very positive. So we may go a long way with these online sessions.
Good. So in general, what sort of feedback have you had from patients and their carers? What have they liked or not liked about your stance program?
They like to meet face to face. Nothing like meeting people face to face, giving hand, just holding their hands, or that's what they miss. Let's go out for a walk, which is good news. So they would like to come and join us sometime soon. So we had a coffee morning the other day, and they said, "Oh, you left us, but we had to follow restrictions. We couldn't have more than 4 people in the offices." So we are getting there.
Good. Sarah, have you had feedback from patients?
Yeah, a lot of the general feedback is that they were grateful that they'd had it and they'd learnt a lot of things that they didn't know. It was very informative, and it was good to see, because we do there's pictures and things like that of different problems that can happen with the feet, so it just highlighted that bit more, and people found that was quite useful to be able to physically see some of the things that can go wrong if you're not looking after your feet with your diabetes. So a lot of feedback was very positive and they enjoyed it and was very informative, so it's helped them to recognise problems now.
Good. Michelle, sorry, we seem to have lost you at some stage. Would you like to introduce yourself and then I'll ask you a specific question?
Hi, I'm now back in the right place. I went into a totally different session. Hi, I'm Michelle Rigby. I'm based up in Betsy Cadwallader University Health Board, and I am the Senior Coordinator for the EPP Cymru office, and we provide all of the type 2 diabetes education within the Health Board. So
Michelle, could you tell us a little bit about why your Health Board was interested in adopting stance and what the journey's been like in engaging stakeholders within Betsy Cadwallader?
Okay, yeah, as I've said, we do coordinate for all the type 2 diabetes education within the Health Board. So really the stance programme added significantly to what we would have on offer and covers the extra podiatry information that we didn't necessarily have the in-depth type of information available to our participants, and it just added to that suite of education that we have available. As far as the second part of the question, so engaging those stakeholders, it was a relatively long process. We had been in discussion through all of the diabetes delivery groups, and initially it was about communication issues that we had. Actually, my rookie mistake was I sent them the main invite to participate to the wrong person. Rookie mistake. But once we did get that support from the National Diabetes and Podiatry teams, and we got that engagement going and helping me find the correct contact, we actually set up a couple of meetings and went through and really developed and discussed how we could make stance in its put together product really work for BCU, for the podiatry service, but also for those participants. So it really was that engagement, when I got it right, really worked well.
Okay, so we have talked a little bit about how COVID has affected the programme, with people not being able to get face-to-face meetings and having to learn new IT skills and having to teach people new IT skills in order to help them to engage. Is there anything else you'd like to add about how COVID affected things in Betsy Cadwallader?
No, it's similar sorts of things. It was learning the new VC options. We had got to the point that we had actually established all our community courses and we'd got people booked on pre-COVID. So that did give us a little bit of a hiccup, because some of those people who had already booked on hoping for that community session couldn't actually access the online forum. So we do still have a group of patients that we will be going back to once it's safe to do so. But it was that learning the different formats and the way that we could deliver it effectively, and also how we could get the tutor training online.
Yes, it's been a huge learning curve for many of us, including our patients. So could I ask each of you to briefly describe some of the results of this programme that you'd like to share with everyone? So should we start with you, Sujata?
Thank you, Maya. The project Healthy Feet and Healthy Me brought together people who speak the same language and who are diabetic. So thus creating peer mentors group, and the mentoring followed it up with a one-to-one mentoring sessions where needed. So these sessions offered personal support to overcome a range of challenges, in addition to building confidence and self-awareness and adopting positive life attitudes. Sharing experiences of those who reversed type 2 diabetes was well received at one of our sessions, and we also invited consultant endocrinologists from the secondary care who had an informal chat with the patients online. So they were well received. These are very good results, wherein people felt that they didn't have to go anywhere. They can sit at home, go online and meet somebody, a consultant as well. So sessions on foot care education led to healthy eating cookery sessions. They wanted, it's not just about foot care. How about lifestyles and healthy eating? So they asked us to create cookery sessions, and we are working with Diabetes UK to develop those cookery sessions soon. And for our beneficiaries, medical technology on terminologies and jargon that really had constituted a barrier. And so we have broken down those barriers, and they understood most of the terms. They didn't even know what blood glucose mean and how much it is, how they have to control, what does it mean, what's the value. So even creams that they have to use, foot care creams, what they have to use, how to cut nails. It was difficult for us to show it online, but we had to buy a nail cutter or something to show them how to use it. So it was an experience for both us as a charity and trainers, as well as the patients and the beneficiaries. It's a learning experience for all of us.
Thank you. Sarah, what do you think were the results that you'd like to share with us?
For us, the results that we got, we'd run a few courses over 2019, 2020, just before we'd got locked down. And we actually had 112 patients go through our stance programme at that point. So that was obviously because it was new at that stage. So that was really, really positive. And then we sort of worried a bit, thinking we're stuck in lockdown, we can't get out, what we're going to do. But once we managed to get the courses running virtually, we have still managed to get another over the last it was over our quarters are quarter 2 and 4, so from June, July and August, and then January, February and March, we've managed to get a further 35 people through on a virtual programme. So the numbers are not as high, but we're running, and we're hoping to go back in the community. So we've had some good positive outcomes from it, and it's one to continue with. So
thank you. Michelle, what would you like to share with us?
Okay, our take on the programme from BCU's perspective wasn't so much about actually the stance programme. We saw it as a really good innovation that had already been tried and tested, but we were looking at another way to engage more stakeholders within the organisation, empower and activate more participants to really get involved in their ongoing self-management right the way across the board, and it actually to become one of those mainstays within BCU, that self-management was an automatic response rather than an afterthought. So it was about engaging those different stakeholders, which we appear to have done. And also the other side of it was to engage more and enable more options and places for us to deliver. So we have actually achieved that, actually in a totally different way than we ever thought we would, because basically we've been trying to get a VC or an electronic option going forward. We've been working on that for 3-4 years. Actually, COVID's enabled that to happen within less than 6 months. So there is a silver lining to COVID, and it's given us the outcome, not in the way we planned, but it has given us an option to go forward with now.
Thank you. Yes, I think while COVID has been extremely difficult, it has really enabled change within healthcare that we could never have anticipated and would have taken years for us to have achieved otherwise. Okay, I can't see any other questions come through on the chat. If you have any questions, please put them in there. But now we're going to have a short video before we go to the next set of discussions. And this video will highlight all the projects that are showcasing over the lunchtime section. Thank you. Okay, so what's next for the projects in your area or in Wales? Where do you see Stance expanding or growing? Sarah, would you like to start with that?
In our area, we are going to continue to run the sessions and try and increase the amount that we can offer to people throughout Howell Health Board. So we've already got them through all of the 3 counties within our health board. So we are going to just continue and try and get more and more people educated on how to look after their feet.
And are you going to continue with online, or is it all going to be face-to-face, or will you have a bit of a blended mixture?
We are going to do a bit of both. So like I said, because we've found that online is actually giving us a little bit of a positive in reaching patients that we perhaps wouldn't have got to before, especially like housebound, or some of the carers, if they can't get out to sessions because of the person they're caring for, can easily log online and do a session with us. So we are going to run both face-to-face and virtual programs.
Okay, thank you. Michelle?
Okay, so for BCU, what we are going to be starting doing as the restrictions do start to lift, we are going to be going back to community. So we're going to start working on some of the outcomes that we were looking at initially So that will be engaging with the clusters. So our aim is that stance actually goes a lot further downstream, so that we're getting people really early in their diabetes journey, so that we can provide them with general diabetes education, but also this stance education as a sort of blended module. So we're actually really engaging with our GP clusters, working within the 14 different areas of North Wales, and we get it into as local community as possible, as well as continuing with the online modules, because as Sarah has said, it has actually given us access to a group of participants, a group of people that wouldn't necessarily have accessed via the community's offering.
Okay, Sujatha, how do you see it
Yeah. With this project, the demand for foot care for those with diabetes referrals have increased tremendously, and we are planning to go pan-Wales because we already received referrals from Newport and Cardiff. And on that note, we also received queries on other issues that may rise due to diabetes, which is renal and eye care. So we are working out partnerships with renal and kidney and eye care, etc., to mirror similar project that we delivered on foot care. We are the first non-NHS to be involved with the Bevan Commission and also EPP, I think. So we would like to build it up with this partnership and also expand the mentoring facilities around this healthcare, because mentoring on a one-to-one level is so important and it's really effective. So we want to build on that. With your permission, can I read out the message from Angela Jones, please?
Of course.
So this is a message from Angela, and she said, I'm hoping we can get back to a face-to-face group work followed by the one-to-one consultations. This had the largest impact on our patients' ability to remain engaged and activated in their foot health. The Stance patient booklet has now been translated into a number of languages, and we also have the animation you saw to spread the word. We are working with Ideal Diabetes in England to adapt their approaches in Wales for diabetes care. These include KPI, that is key performance indicators, providing and sharing models of best practice, increasing availability and uptake of diabetes education, and optimizing blood glucose management. It's vitally important that charities like TMR, the mentoring, are supported by the Welsh government in what they do. The mentoring has the skills and access to groups of people at most risk of diabetes, and we need to take full advantage of that. That's a message from Angela Jones.
Thank you. So what would you see as being the ideal number for a group taking part in a stance project? The number of participants?
Shall I?
Yeah,
I think that
we normally 15 is the maximum, 15 to 16 maximum. That will be very interactive, and they feel at home and they talk to each other. The bigger the group, they feel alienated, cut off, because they form subgroups as well. Yeah. So 15 is the maximum, I feel, with my experience delivering the project. Over to you.
Okay, Sarah, what do you think about an ideal number?
No, it's the same as what Sush said. I was going to say, I think it depends. I've seen groups of bigger sizes where they've worked. You know, you can do it, but it's not as effective because, like Sush said, that people sort of start forming little subgroups, chatting and things like that. So to actually get the best, you're looking about 15, 16 people on a session. So.
What about smaller sessions? Because many parts of Wales are quite rural, and you know, if you have a large session, you're going to have to ask people to travel from a wider area. Yeah. Michelle, what do you think about a minimum number?
There is a minimum number. I agree with both Suj and Sarah. The maximum is about 16 for a group to run effectively with the scripted programme. But we can we can make the assumption that 6 is the lowest, the smallest size of a group to be a cohesive group. It's repeated throughout patient education that a group size is a minimum of 6. There are some groups that do actually operate below that number, but it is the exception rather than the rule. So keeping to the 6, and actually keeping to the 6 that are likely to turn up. So do remember that there will be various times that people drop out.
Okay. So is dropout much of a problem? Do you find that it's easy when people have started to engage that they do commit to the course?
It's a one-off session, the stance. So once they're there, they kind of stay there. So, but yeah, once you get people committed and they come along, then you've got them then, and they enjoy it then. So
it is all about that patient activation, because if they turn up to any of the education, normally it's that initial connection and the fact that we activate them. We work within the programme and activate their interest, that they will actually commit to longer courses as well. Good. So they keep coming back.
So it's that initial getting them there is the difficult bit, I should imagine.
Very much so.
Okay. So thinking about taking on an innovative programme, what would your recommendations to anybody who's watching this, who is thinking of taking on an innovative programme? What advice would you give them from what you've been through? And perhaps we'll start with you, Sujatha, because you said this is the first time a third sector charity has been involved with the Bevan Commission. So if there are anybody from other charities, what advice would you give them?
Well, we are a very small charity, but we work with the grassroots level. That's important because bigger charities may not. I don't know. But as far as we are concerned, we work with them very closely and we develop many groups. So especially with the ethnic minority communities, we formed a group wherein they felt very confident. This is the best partnership that we ever received, and then we worked together. It worked very well, though it was remote, especially with Bevan Commission, not just in terms of training, not just in terms of funding, but we have learned a lot how Bevan Commission works and how it works. Bevan Commission works with the NHS and Welsh Government strategy as well, and also EPP. So it was a huge partnership wherein we have got skills from each one of us, Bevan Commission, EPP, Podiatry Department, ourselves as a charity, as well as, I'm not forgetting, our patients, beneficiaries. We learned a lot from them because we didn't know how to cope with this COVID and we didn't know how to approach them. So they have adapted as much as we have adapted. So it was a very good journey for us. It was a seamless journey with Bevan Commission support and funding as well, delivering the project. And we had almost monthly feedback sessions, and we had good network sessions as well to showcase our progress. So which was very good learning for all of us. And there is a lot to learn from our journey and a room for improvement. So we are waiting for how to go ahead with a better project or improved version of this. I also want to say huge thank you for all the work to bring us to where we are. Otherwise, I don't think we would have been here. It has been lovely working with you, Bevan Commission, and Cardiff and Vale University Health Board, EPP, and Diabetes UK, who gave us the material. And I've learned a lot from all of you with your experiences and knowledge, and above all, those who attended the sessions.
Thank you. So, Sarah, what messages would you give to anybody thinking of starting an innovative program or adopting it?
If you need healthcare professionals side, get on board with them first. Okay, so you need those to help you out there, and make the most of all the support and the help and the sessions that the Bevan provide, because they're really useful and they're really helpful. So there's quite a few things that I've learned from the different sessions that have been provided from Bevan. So it's been we've been good there. So make the most of what you get from Bevan, and get your healthcare professional side on board straight away as well.
Michelle, what messages do you have for anyone thinking of taking on innovation?
Okay, what I'd say to anyone who wants to take on an innovation is have a passion for it. You'll probably need it. There will be ways that we need to adapt and flex. Be prepared to make those adaptations and move with it. And all of that needs to be underpinned by that co-production, whether it's with the healthcare professionals, whether it's with organisations such as the Bevan Commission, and whether it's with the participants and responding to their feedback. But it is that constant co-production. Be willing to adapt and have a passion for it.
Sujatha.
Here is a message from Angela. May I read that, please? Angela says, go for it. You have to in order to be a part of the revolution in healthcare, but do it with the Bevans Commission, because you will have all the support and advice you need to support you through the inevitable hard times. And remember, the path you will go on will not be the one you planned. It will be so much more scenic, scary, and rewarding.
I think those are very wise words, aren't they? Yeah. Okay. Any other messages that you'd like to give to anyone who's watching? Okay. Sujatha?
It's about passion and how we reach the community. Ultimately, it is the people. It's the people who need support and who need guidance. And then, of course, we need strategies. We need, how to plan. Funding is the main one, which we need to work together so that we have projects in place. And of course, guidance from Bevan Commission, which is very important. So that's a message from me.
Okay. So there's a message in the chat from Scott Coley, who's the National Diabetic Foot Coordinator. Informed and activated patients make better choices with improved outcomes. Well done, stance and team, for supporting this journey. And I think I'd like to echo that as well. I think what you've demonstrated today is that an idea that you have to make patients the centre of their own care and give patients the responsibility is really so important. Patient education is vital. If patients don't know what to look for, particularly when they have problems with their feet, if they're diabetic, if they don't know the signs to look for, they're not going to get help early. And we all know that once it becomes a bad infection or a deep ulcer, then the chances of it healing fully, and healing, it takes such a long time to heal and has such an impact on their life in general. So patient education is so important. You've highlighted the importance of relationships and making those relationships and keeping those relationships going, relationships with other professionals, relationships with your patients, and helping them to form relationships amongst themselves. You mentioned how important mentoring was for them. Communication is one of the other really important messages that you've given us today. The importance of being able to communicate with all our patients and to try and overcome problems like language with ethnic minority patients. It's really vital that patients obtain the message we're trying to give them in a language and in words that they understand, not just in terms of technical medical terms that we're all very used to using, but often don't mean quite the same to our patients. You've overcome problems during COVID that none of us could have foreseen. And in some ways, that was a bit of a silver lining, because you were able to teach patients IT skills that they probably would never have bothered to find out about. And that's given them access to so much more than just their foot care. You've been able to reach the patients that are hard to reach because they are stuck at home. And if they've been able to then access IT, you've been able to get to them. You've developed mentoring skills with your patients. And some of this, I've heard of how this is leading to other things like better general care of your diabetes, with things like the cooking and the eating, and becoming much more aware of what your blood sugar means to you as a diabetic. But I think most importantly is that this project has had the patient at the centre. And I think that that's really, really important, because without our patients, we can be as passionate as we like about care, particularly care of diabetics, but we've got to take our patients with us. And I think this is a really good example of prudent healthcare, with COVID affecting so many services and everybody in primary care and in secondary care feeling overwhelmed by the backlog of cases that we have to deal with. I think anything that enables patients to take responsibility and to be educated and to know when they need to seek help and when it's safe for them to look after things themselves. So well done, all of you. I think this has been a really wonderful project. I can't see anything else in the chat. So if anybody would like to make any final remarks, otherwise I will draw our conversations to a close. I can't see anybody keen to say anything else. So we have a final video that we need to watch now, and thank you all very much for joining us. Please do keep in touch, and best of luck to all your projects. I hope the funding finds its way to you and that you're able to take these projects forward. Well done, everyone. Thank you very much indeed for sharing today.
Thank you.
Thank you very much.